today, after a break since last June, we want to do a small briefing on the Montreal situation. We see, of course, since last week's, we've seen an increase in almost all our indicators, our incidence rate, and of course it is associated with the introduction of the variant Delta. We have an average of about 170 new cases each day, and more than half of our cases are associated with the Delta variant. If we compare to last year, we had those same indicators at the end of September, so we haven't seen the effect of the opening of the schools, and still we have high incidence rates. So we expect, of course, seeing a larger number of cases in the next couple of weeks. Our incidence rates are highest in the age group 18 to 34 years old, but we also see an increase in the 5 to 17 years old age group, the school age children. We also see a positivity rate that is increasing, and we have in some neighborhoods more than positivity rates higher than 5%. So we see in Saint-Michel, Parc Extension, Bordeaux-Cartierville, and Rivière-des-Prairies. We are managing currently 46 outbreaks, and I want to do a focus on specific outbreaks that we've seen. We have 11 outbreaks specifically associated with different gatherings around dance or the dance communities. And we see cases in the dancers, but also spectators. So the tracing is quite difficult because, of course, those events are outdoors or indoors, and we do not have any registry. So we ask people that do attend those events to be more precautious, keep their distance, of course, wear masks if they're indoors. If they are dancing, choose their partners and avoid changing partners. And of course, if you have any tests, please go and get screened to make sure to validate if it's COVID or not. Good thing is, as we're speaking, we still have low hospitalization rate and intensive care unit admission. Last week we had 16 new hospitalization and 4 admissions in intensive care. In our projection, it is going to increase, but at the time we're speaking, the capacity of the healthcare system is still there. Of course, knowing that the Delta variant is more contagious, and of course it is more at risk of severe form of the illness that compared to the Alpha variant, and knowing that the vaccination is good, it protects from severe illness, but it is not perfect even with 2 doses. We really of course ask our population to get vaccinated, because there is a gain at the individual level but also collective level. But we ask people to be more precautious in their contacts, keep their distance, wear masks when they're indoor, wash their hands. And of course, I know during summer we had the reflex to sometimes shake hands or do accolade or a kiss. I think with the circulation of the Delta variant at the time we're speaking, we should be precautious and do the same reflex that we had during the last year to wash our hands, wear masks, and keep our distance. The schools are reopening. We're quite happy to see that the mask is going to be mandatory at all time in classes. It's going to help us to, of course, control outbreaks, but also when we will have to do our search and contain strategy. We are going to have all schools are going to be visited for a vaccination campaign, so it is going to be offered to teachers, people working in the school setting, and of course children. And we do still have a lot of progress to do in Montreal. 52% of our 12 to 17 years old youth are fully adequately vaccinated. It is not enough to have at a collective level an impact on the school to contain the outbreaks that we're going to have, or to help us contain the outbreaks. So we ask teachers to get vaccinated, and also people working in daycare centers. If you're working with school-age children that are not vaccinated, you should really consider yourself more at risk of being in contact with the virus this fall. And because you're older than children, the risk of having more severe form of the illness is higher for you. So please attend or get your 2 shots as soon as possible. So we're working with schools to make sure that we have back to school that will be secure for all children, and to as possible as we can make sure that children could attend a school in presence. So we may have to adjust during the next weeks, but at the time we're speaking, we're working with this scenario. Thank you.